I've been performing cosmetic procedures for 23 years. Botox is a protein, and its active ingredient is botulism toxin. There are several brands. Dysport is one. Botox is the oldest brand. Dysport's been around for the last, I think, 12 years. And they both work in similar fashions. They both have botulism toxin. The botulism toxin is attached to a carrier protein, and that carrier protein is different for the different companies that make botulism toxin. So Botox has a very large carrier protein that's very tightly bound onto the botulism toxin. So you inject it in, and the carrier protein and the botulism toxin must separate. Then the botulism toxin will float down and attach to a puzzle piece that it only fits into, which is on the postsynaptic neuron on the muscle. And once it attaches, it actually won't come off. It's permanently associated with that receptor, and that receptor has to do with neurotransmitter reuptake, and so the neuron will actually run out of neurotransmitter and then kind of stop functioning. So the nerve, the muscle won't get any signal to contract. So the muscle actually will relax. Even the normal tension on the muscle will relax. So it's kind of a muscle relaxant. And we only inject it into the muscles we don't want to work. And we use micro amounts. Dysport is a competing brand to Botox, and it has, it's a kind of a newer version. It has a smaller carrier protein attached to the botulism toxin, but it's loosely associated. So you inject it in, and almost right away they start to dissociate, and the botulism toxin starts to attach to the receptor. So your onset of action is much faster with Dysport. It's within 2-3 days, where the dissociation of the botulism toxin and its attachment to the receptor takes up to 2 weeks. So it's much more delayed with the older Botox. Once the receptor is occupied with the botulism toxin, like I said, that's a permanent thing. The thing is that we make new receptors every 3.5 to 4 months. And it gets degraded into its proteins, and so then a new receptor pops up, and you have to re-inject Botox or Dysport in order to have the same effect. People who are very expressive in their upper face are very good candidates for Botox or Dysport. People who find that they have frown lines and or laugh lines that are constantly, their faces are constantly in motion. When you bend your skin over and over and over in the same spot, that wrinkle becomes engraved into your skin. So if you don't want the wrinkles to get engraved, then you just do Botox or Dysport to make your skin kind of relax those skin lines. And if you, like me, I've had a horrible frown line there. I've even had patients stop me years ago before Botox was in use and say, well, why are you mad at me? And I'm like, I'm not mad at you. Why are you asking me why I'm mad at you? Because you're frowning at me. I'm like, I'm not frowning at you. I'm just concentrating on your problem. So I totally understand when people get misunderstood because their facial expressions don't match what they're actually feeling. So that's a very good reason to do it. Some people will, when they speak, their chin will cobblestone up and make little dents and things. And the Dysport or Botox makes that nice and smooth. I think Botox and Dysport are incredibly natural looking. It's not something that is obvious to other people. To you, you know, you look better, and to others, you look maybe more serene, and less crinkly or less stressed out when you have the Dysport or Botox on board. But it looks natural. Other people would never really know. You can always do it so you still have some movement. So if you're just really self-conscious that somebody might notice that you can't frown, you can always have a little frown if you want. The Dysport and Botox is done very quickly. It's almost kind of like a vaccine against wrinkles. It's that fast. So you lie down, we wash off a little alcohol, put a little ice pack on so you don't feel it, and inject the areas that need the Dysport or Botox. Put a little pressure on with some pads to decrease your chance of any bruising. And it really doesn't take very long, 5 minutes. Right after the injection, it's going to be a little bumpy, but within a half hour to an hour, nobody would know. It's completely flat. They're not permanent. Dysport and Botox are the protein, the botulism toxin protein, attaches to the receptor in a permanent fashion. However, the receptor gets degraded after 3.5 to 4 months, and you make a new receptor, and that receptor then will need to have more Botox or Dysport. So 3.5 to 4 months is about 96% of the population will be, and it'll be effective. The cost depends on how much you use. It is sold by the unit, and it is anywhere from around $350 to $800 for most folks. Northwest Face, the doctors at Northwest Face and the providers here are really focused on quality. We have more experience, I think, than you'll find most anywhere. We're an amazing team that works well together, and we're extremely focused on patient outcomes and safety. So I think that that makes us somewhat unique, in that we are very concerned with the outcomes and patient satisfaction, and only offer things that actually work.